Hello, my name is Cheryl Moose, and I am a nurse educator. The area of advanced nursing practice that my education project is dealing with is obstetrics. My project deals with new staff in our unit. We have several new staff that have started, and it is our policy that you cannot triage obstetrical patients until you have 2 years of experience. However, you can do this if you utilize the charge nurse as a resource and have her go over your assessment and the information that you've gathered prior to calling the provider. With the new staff that are on the floor, it was brought to my attention that there are some concerns from our providers that these new staff don't have the basic knowledge and skills that is needed in order to take care of obstetrical triage patients. So therefore, I thought it would be a great idea to come up with an education project that covers just that. I reached out to all of our providers, including the doctors and the midwives, and asked for their issues and concerns with this new staff and the area of obstetrical triage. Based off the information that I gathered from them and other things that I had found on the unit by providing a survey to our new staff, I designed my project based on those needs. My PowerPoint will go along with a lecture that I'm giving to allow the learner to have some visual aids as well as notes up on a screen so that they can write things down as I'm going through the information. One of the really important things that I cover is EMTALA and how it does relate to obstetrical triage. I also go over the assessment that they need to do with this special patient population based off of the chief complaint as to why these patients are being seen. I also go over the assistance of the provider with a sterile speculum exam, culture collection, fetal fibronectin, and things like that. One of the main concerns that was brought to my attention was the fact that these nurses were calling the provider without all of the information that was needed. So I'm going to create a template that goes over the information that they should gather, and I'm also going to laminate and put that into our clinical folder so that every time that they have a triage patient, they'll have that guide that walks them through the information that they need to gather and have prior to calling the provider and letting them know that the patient is there. I will have some hands-on practice for the learner to go through with the cultures and speculums, and I'll also have case studies for them to be able to critically think through with the obstetrical triage scenarios that I will provide. I will evaluate the effectiveness of this with a pre and post test with the exact same questions, and the goal obviously is that the percentage correct would increase after the course. But my main goal is to make sure that the confidence and competency of our nurses increase in triage, and that way we can provide even better care to our patients. Thank you.